Hey everybody, I'm here with Dr. Larry Leverett at Body by Leverett. You can find them at leverettmd.com. So we're here to talk about cosmetic surgery and some of the procedures and treatments available today. So Dr. Leverett, thank you so much for joining us today. I appreciate it.
Thank you for having me.
Yeah, absolutely. And I wanted to start off just by asking how long you've been working as a plastic surgeon.
I'm in year 28. I came out here. I'm sorry. I'm in year 27. I came out here, started my private practice in 1995.
Okay, awesome. Was there anything in particular that really drew you towards that and made you want to help patients with their cosmetic goals?
Well, I didn't start out with the intention of becoming a plastic surgeon. I started out with the intention to become a general surgeon, and I did general surgery. Loved it. I'm board certified in general surgery. But during my general surgery residency, I rotated to plastic surgery. And at that point, I just love the elective nature of the patients. Patients actually wanted to have surgery as
Sure.
opposed to the patients that needed to have surgery.
Mhm.
And you never had the same algorithm for what would likely make the patient happy.
Hmm.
I thought that was very thrilling because not everybody's painted with the exact same brush. So the surgeon had a chance to be very artistic,
Mhm.
and I just fell in love with it.
Yeah, I could definitely see that. And since the end of the pandemic, it seems there's been a big increase in patients, coming back in and getting procedures done again. Have you guys noticed that at your practice as well?
We have the pandemic opened a lot of eyes in a lot of ways.
Mhm.
For patients who were on many Zoom calls,
Mhm.
they saw their faces,
Sure.
uh, and many times they saw on screen things that they had not seen and had not noticed in the mirror.
Mhm.
And so the facial procedures came to an increase. Also, patients who were working from home found that they could theoretically be working from home while rehabbing from home with post surgery and not losing any time away from work, or losing very minimal time from work. So the pandemic helped in that regard quite a bit.
Yeah, definitely. I can see that. And I wanted to find out from you, what are some of the main procedures that you focus on there at your practice?
Well, here at Body by Leverett, we do all breast and body procedures: facial rejuvenation, facelifts, eye lifts, neck lifts,
Mhm.
breast lifts, tummy tucks, liposuction, breast reductions,
Mhm.
implant exchange, implant removals,
Mhm.
BBLs, whatever the patient is needing. We also have the full line of injectables,
Mhm.
with fillers and neurotoxins such as Botox. And then we also have a fully qualified esthetician for all the facial procedures. And so we just have the full gamut here.
Okay. Yeah, that's fantastic. Is there a, particular procedure or two that you'd like to share some good education about for the viewers?
Well, I think everybody knows that here at Body by Leverett, we really focus on body contouring.
Mhm.
But over the last several years, there's two things that have really changed the way that we've done things. One is, and they're both medications.
Mhm.
One is called Exparel, the other is called Dysuvia.
Mhm.
And Exparel has really transformed the patients who opt for procedures that involve muscle tightness, such as breast augmentations
Mhm.
and tummy tucks, because what the patients originally feared was that post-op discomfort,
Mhm.
and the Exparel works like a post-operative epidural that people have for childbirth,
Mhm.
which takes those first 3 days of discomfort away.
Mhm.
And that's important because the first 3 days, they have to be the worst 3 days. And so it takes those away. For patients who have addiction problems, they can many times do procedures without narcotics. For patients who have nausea from taking pills,
Mhm.
they don't have to take the pills. Also you get a lot less opiate induced constipation. So Exparel has been phenomenal in making certain procedures really, really comfortable as compared to what the way that those procedures were perceived
Mhm.
for the previous 40 to 50 years.
Yeah.
The second is something called Dysuvia, and Dysuvia is a medication very similar to what dentists use in the office, where they're using nitrous for dental fillings,
Hmm.
in which the patient is awake, arousable, alert, aware of what's going on, but they don't perceive pain
Hmm.
very much. And so you can do a lot of procedures in the office, away from the hospital, away from anesthesia,
Mhm.
that previously there was cost and time that was involved
Sure.
And so we were able to do those procedures here in the office, such as removing breast implants, eyelid procedures upward, lower, lumps and bumps, small areas of liposuction, neck lifts, secondary facelifts. All those can be done in the office because the Suvia is a very inexpensive pill, and it basically gives you 3 hours where you really don't perceive very much pain at all, and it does not suppress the respirations, and there's really no side effects. It's just the patient can't drive legally for about 3 hours. So that has been transformative in our practice.
Yeah, absolutely. I can imagine with those procedures before, did you have to place them under general anesthesia?
They were on general anesthesia, and we talked them through it, and they were on pain medications post-op, and many times doing the procedures. And this makes life much easier post-op, especially with the extrareal, and intra-op with the Suvia. So we think that those two have been very good medications for us.
Yeah, absolutely. And for the body contouring procedures, what are those ones specifically? What are some of the main, benefits that patients are typically looking for with those?
Well, and the most common procedures are still breast surgery, liposuction, tummy tucks, and what we call mommy makeovers, which is a combination of breast and tummy. Many times patients will liposuction to reduce the fat and optimize the contour, and occasionally they will have the fat placed back into their buttocks in reference to what we call the Brazilian butt lift. So those body contour procedures are still very prevalent. It allows the patient to get back to his or her form. Most of the time it's after pregnancy is over and or after massive weight loss. So it's a tremendous adjunct to their confidence, and it's just been life-changing.
Yeah, absolutely. I can definitely see that. And how long do the results typically last with those mommy makeover procedures? And what do you recommend for patients to be able to maximize, the results they get from those?
So the ideal patient usually is someone who has a BMI of less than 30. If we're doing tummy tucks, we want them to already be finished with having kids. Occasionally, like the lady that we did just yesterday, she was in her 20s and we did a tummy tuck, had not had kids yet, but she lost 140 pounds to get here. So we did the tummy tuck with no muscle tightening, which makes it safe for childbearing as she goes along. But ideally, patients less than a BMI of 30 if they're female. If they're male, it's more because the BMI scale for males and females are not the same. With regard to breast surgery can be different. Primary breast augmentations are making which we enlarge the breast. They have to be 18 years old. Sometimes if the patient has a congenital anomaly, if one breast is significantly larger than the other one, let's say she's a D on one side and B on the other side, we can actually do those procedures earlier. And that's important because when they are so asymmetrical, they have tremendous hits to their self-esteem. For the breast lifts, breast reductions, most of the time those patients who have either or losing weight, or they've lost weight, or they have breastfed and the breasts look different after breastfeeding, and that's called postpartum involution. So sometimes the patient needs implants, sometimes they don't. Depending on how much breast tissue they have, most of the time they'll choose silicone because it's softer, lighter, and it feels more breast-like. But if she has plenty of breast tissue, she can still get a nice result from using saline, the old-fashioned saline, because it's less expensive.
Sure. Okay, and then I know the procedures have come a long way over the last decade or so. Is there any particular techniques or instruments or anything that you use to really help maximize the results with those, aside from the advancements we talked about with the medication?
Well, when I was a kid, everyone had to be slim, and so you want to get rid of all the fat. And now we realize that fat is a friend of ours. And so we're adding fat just like we're adding fillers to the face to make them smoother. It makes the neck smoother. We don't take out all of the fat in contouring. We leave enough so that it feels and looks soft. And we add it back to the buttocks to give it a nice, more youthful, round configuration, soft configuration, much more feminine configuration. And so preserving fat is really different from 30 years ago. And because now we know that fat is our friend, just like the fillers and people who don't have adequate amounts of fat.
Yeah. Okay, definitely. That makes sense. And you touched on a little bit who the real, ideal candidate is for those procedures. So somebody that's under a BMI of 30, And then what are some of the other qualifications for somebody to have a mommy makeover?
She must have realistic expectations, right? And so she knows that you should know that every time there is an incision made, there is a scar. We talk about the scar. We hide the scar under the bikini, and we expect everyone to be bikini ready in 4 months or less. The length of the scar is not predetermined. The length of the scar is determined by how much skin they have. It's important that they know how to maintain their weight so that the results last as long as they maintain their weight. It's important that they don't tan the incisions before the redness is gone, or the incisions will get dark.
Okay, that makes sense. And, for a patient that's maybe thinking they would be a good fit for those procedures, what would you recommend as their first best step in choosing a surgeon and figuring out, what they're going to do?
Well, I think the first thing you do is you need to find a board certified plastic surgeon. Make sure that you reach out to his office, his or her office. Tell them exactly what your concerns are. Be realistic. Don't hold anything back to them, because the results that you get may be determined simply by the information that you give to them. So be totally honest with your healthcare team. Be prepared to discuss alternatives that you did not think applied to you, because you're paying for their expertise. And take adequate time to give yourself time to heal. Take time off from work. Arrange for help with small kids. And if possible, bring that help with you at your pre-op, whether that's your husband, boyfriend, girlfriend, mother, sister, best friend, or whomever. That way the entire healthcare team knows what's expected for the patient, of themselves, and of your surgeon.
Yeah, absolutely. That's great advice. And what would be the best way for patients to get in contact with you?
Well, you can always, the best way is to call us here in our office at 480-706-5830, 706-5830. Website is Body by Leverett. If you call the office, ask for Carrie with a K, and we'll get you right in.
Okay, perfect. Well, yeah, those are the questions I had for you. So I really appreciate you taking the time to share the education and give us the good information. I appreciate that.
It's a pleasure. Look forward to seeing you soon.
Absolutely. Right. Have a great rest of your day, Dr. Leverett.
You too, sir. Good night.